Everything is going well for you and your family. Today, we're going to talk about ADHD in teens and some helpful treatments that have known to be effective in helping younger people manage ADHD symptoms. I've been noticing a significant increase in cases of clients who report symptoms consistent with ADHD. Says here, ADHD is a neurodevelopmental disorder defined in the DSM-5 as a persistent pattern of inattention and or hyperactivity, impulsivity that interferes with functioning or development. To meet criteria, several symptoms must have been present before age 12 and appear in two or more settings like home and school and clearly reduce the quality of social, academic, or occupational functioning. I've also been noticing an increase in adults as well. When I worked in clinical settings, I've seen a lot of clients who come in later stages of their lives reporting symptoms of ADHD, difficulty focusing and concentrating. So it says here, in teens 17 or older, there has to be at least 5 symptoms in each criteria met. However, younger, I believe it's 6 symptoms for younger teens from either the inattention or hyperactivity, impulsivity categories, lasting at least 6 months and being inconsistent with developmental level. So the two main types of symptoms are inattention. It shows up as making careless mistakes, struggling to sustain attention, not listening when spoken to, failing to finish schoolwork or chores, trouble organizing tasks, avoiding sustained mental effort. All right. So these are the teens who are having difficulty with managing attention and focus when it comes to reading. This tends to be like a telltale sign of some of the symptomology in ADHD when individuals have difficulty reading a paragraph, 2 paragraphs, sort of like sustaining attention in some, long chapter books and different things like that. And of course, you know that you need to, to some degree, have, some skill or attention in some of the academic material to pass the course, right? You have to be able to sustain your attention when you're reading. So that tends to be sort of like a telltale sign. So difficulty sustaining attention and trouble organizing tasks, avoiding sustained mental effort, losing things. And back to the sustained mental effort, one way that you can train the maintaining sustained mental effort from my work in the clinical work with ADHD is doing mindfulness meditation. You can do breathing exercises where you actually count the exhale of your breaths. So, you inhale, one. Something like that is good for people who have ADHD, especially teenagers, because as you're tracking each breath, that number is a way that you can anchor your attention. And also it's a good way to kind of slow down sort of like that impulse brain, the impulsivity that comes up with ADHD. So just practicing meditation in the research, it says that it does strengthen the neural pathways around sustained attention that tend to be really low with ADHD clients. So doing mindfulness meditation through either the Headspace app is a really great. I want to say they have an app called Insight Timer that's really good as well. So at least 6 symptoms for 17 are under in the inattention or hyperactivity categories. So again, we have in the inattention, making careless mistakes, struggling to sustain attention, not listening when spoken to, failing to finish schoolwork or chores, trouble organizing tasks, avoiding sustained mental effort, losing things, right? Like your phone, your keys, your homework, being easily distracted by unrelated thoughts or noises, and being forgetful in daily activities. Hyperactivity, impulsivity includes fidgeting, leaving the seat when expected to stay seated, feeling restless, inability to engage quietly, constantly being on the go, right? Constantly kind of getting up and down, moving around, kind of, can't really sit still, very restless, feel as if they're driven by a motor. All right. When you see that in clinical terminology, it's essentially saying that the person, you know, has this sort of consistent or persistent, movement where it's like they're turned on and they can't turn it off. They're just constantly kind of moving around, shaking, moving their legs and different things like that. So a lot of times ADHD can get mixed up with anxiety, and the reason is because the presentation of both look very similar on the surface. And one of the key differences between dominant anxiety symptoms and ADHD symptoms is that with anxiety, the symptoms are usually driven by a perceived threat or fear. If the person is having similar symptoms of ADHD or anxiety, but there's no fear, there's no threat, more than likely there can be, symptomology of ADHD. But if if a kid is worrying, a teenager is kind of nervous, if there's, stuff going on at home, if, somebody's going to bully them or something like that, then you'll kind of, want to categorize some of those symptoms under anxiety. And you can have both working in tangent together. But it's really important to be able to delineate the difference between anxiety and ADHD, because you see a lot of clients and adults who get diagnosed with anxiety when in reality the symptoms are ADHD driven. And all you're doing is just sedating the restlessness, but the person is still having difficulty focusing and concentrating because of those impairments in that dopamine, serotonergic sort of like regions of the brain. So there is a specific medication that's designed with ADHD that targets different centers than anxiety medications. And it's really important to make sure that the ADHD diagnosis is correct, because if you're taking medications for ADHD, but you don't have ADHD, you could potentially develop Parkinson's disease. So, really important to be able to tease those differences out. And in some settings, they won't even move forward with treating the ADHD until you get the anxiety or the PTSD symptoms treated first. So if you know you have PTSD, if you have anxiety, if you have other mental health issues on top of ADHD, it's really important to get that stuff diagnosed ahead of time, get a treatment plan for it, get it treated. So that way, when they're diagnosing you and giving you treatment plans, they give you the correct medications. Here, so we have the inattention and we have the hyperactivity, impulsivity, and many teens have the combined presentation. Some people have dominant inattentive, some people have dominant hyperactivity. It just depends on, where you're kind of coming from. So for teenagers, these symptoms can turn normal challenges like school deadlines, friendships, or family expectations into daily battles. A lot of times, dopamine is not just, the reward chemical in our brain. It's also the chemical that helps orchestrate where our attention goes, where our motivation goes. And when that dopamine isn't there, right, you'll find teenagers having difficulties doing homework when they come home, right? They just kind of want to hang out, they're kind of exhausted, they're kind of running on fumes because the resources that they have already been allocated throughout the school day, all right? So sometimes parents have to give their children grace and have to be very intentional on how you structure time outside of school when you're at home, because that drive just isn't there a lot of times. You just don't feel motivated to get to homework and to do certain things. So really making the experience rewarding helps. Like if you have a teenager that's struggling with assignments, give them a reward. Like, hey man, if you can get this homework done, that little apple little pie you like from Trader Joe's, man, we can throw that baby in the oven, light it up. You'll find yourself having to implement more token economy, reward economy sort of strategies with clients or adults or children who have ADHD, because they need a motivator, right? It's really hard for them to kind of just get up and be like, hey, I'm so interested to do homework. And I'm so interested to do this assignment, this essay, right? So really incorporating motivators, right? Things that can help them stay in, sort of like excited about completing the task. So it says here, the good news, ADHD is one of the most treatable mental health conditions. Research shows that combining evidence-based strategies, so that can include medication when needed, plus skill building therapies, can reduce symptoms by 50 to 80%. All right, so we're going to go over about 15 practical CBT tools. CBT is for cognitive behavioral therapy. It's just a theoretical model in psychology that teaches people how to challenge any sort of beliefs, rules, assumptions, or behaviors by rewiring how they're interpreting the situation. And not everything is cognitive based with CBT. They do have behavioral strategies and approaches too that are really good. So building self awareness and planning is so important in ADHD treatment. Daily symptom tracking. I can't tell you how important it is to track your symptoms before you go to a therapist, before you go to a psychiatrist, psychologist, about any mental health symptom, whether it's anxiety, depression, PTSD, mood disorders, psychotic disorders. Track your symptoms. This way, you'll have evidence based off of week to week observations, right? When are there peaks in some of these symptoms, right? When do you notice some of these symptoms reducing, right? Are there periods of the day where more than likely you're going to experience symptoms? Or are there periods of the day where you're less likely to experience symptoms, right? This is education and work clients can do on their own, right? You can get tracking charts from Google. You just type in, symptom trackers. You could probably have 100 different forms on how to track symptoms, right? And what you want to do is get like a healthy baseline of the frequency and the consistency of some of these symptoms, right? Because they're not in a monolith, right? They're not going to all exist at the same frequency and the same rate week to week, day to day, right? There's shifts, there are changes. So you want to really be mindful of that. And also, it's a good way to tap into this reward part, right, of the brain that a lot of ADHD brains tend to kind of struggle with. You get to see progress. Like, man, previous 2 weeks I was struggling, but this week, I noticed there was a decrease, right? That's a good way to reward yourself by tracking, right? It's self-awareness is key to getting natural dopamine, right? Knowing when the symptoms are at their most severe, when the symptoms are less severe, gives me an opportunity to see progress, right? And that is a reward, sort of like an intrinsic motivator right there. All right. So if you want shots of dopamine without having to take medications, if you want natural dopamine without having to go above and beyond, just track your symptoms. That's a natural way to get healthy dopamine. So daily symptom tracking, log moments of inattention or impulsivity in either a notes app to spot patterns without self criticism. The key is to approach this non judgmentally. Two, SMART goals, right? SMART, S is for specific, M is for measurable, A, attainable or relevant, T, timeline, right? So SMART goals are really cool because it's a good way to take a big, large outcome and to break it down into chunks. And that's another way to get dopamine, right? If I can break this big goal down into small baby steps, each baby step I achieve, each milestone I knock out, that's dopamine, right? Research says every time you create a to-do list and you know how you do like a little check mark box, every time you mark off that box with that check mark, boost, you get like a dopamine boost, right? So SMART goals are a good way to get that intrinsic natural dopamine. Tracking the progress, right? Tracking the symptoms is a good way to get that natural dopamine, okay? So SMART goals, the Eisenhower matrix, all right, a quick four-box system to decide what's urgent versus what's important to stop overwhelm. With ADHD, sometimes it can get hard to decide what activities or what tasks are urgent, which ones can wait, right? So they have the Eisenhower matrix, right, where you can sort of organize your mind. Is this a task that can wait, right? Is this a task that needs to get done right away? The 1 minute box breathing, inhale for 4, hold for 4, exhale for 4. Whenever you feel restless or scattered, breathing is always a good way to anchor yourself. Why? Because it's a good way to pull your attention and your resources into the present moment, right? Your breath isn't in tomorrow. Your breath isn't into yesterday. Your breath is here and now. So anytime you're refocusing that attention on the breath, you're anchoring your mind in the present moment, which helps to reduce a lot of that racing thought. Thought happens when your attention leaves the present moment, right? As soon as your attention escapes what's going on in the here and now, thought happens, right? So to help reduce some of that excessive thinking, anchoring your attention, anchoring your mind in your breath, all right? Reframe negative self-talk, all right? Change thoughts like I'm so stupid, right? To this is hard for my brain right now, right? What is one tiny step? So focus in habit building tools, the Pomodoro technique, the Pomodoro technique, 25 minutes of focused work plus a 5-minute break. All right. So this is for people who have difficulty going to the gym, people who have difficulty doing homework assignments, anything where just the dopamine isn't there, right? Tell yourself, I'm only going to do this for 25 minutes. All right. Then I'm going to do a 5-minute break. Don't go in there thinking I'm going to go in there and do a full hour of studying on calculus, right? Just tell yourself, hey, 25 minutes, 5-minute break, 25 minutes, 5-minute break, the Pomodoro technique. All right. And you can use a visual timer. Create a distraction free zone. All right. A dedicated study spot, noise canceling headphones or white noise. Body doubling. Have a calm friend or calm parent nearby, even on a video call. Research says if you have someone calm in the environment as you're trying to complete a task, the likelihood of that task getting completed is greater just by you having a battle buddy, right? Even if it's someone through text, over the phone. Hey, I'm trying to complete this assignment, tap back in within the next 15, 25 minutes, see where I'm at. All right. More than likely, you're going to complete that task having someone, that can join you in that. Habit anchoring. All right. Attach new routines to existing ones. After I brush my teeth, I am going to plan tomorrow. All right. After I brush my teeth, I'm going to go look at this book for a few seconds, right? A few minutes, right? However much you can tolerate. 10-second impulse delay. Count to 10 and ask, is this helpful before acting on the impulse? All right. So, for emotional and social skills, active listening practice, paraphrase what someone said before replying to reduce blurting out responses. All right. Give yourself 10 seconds to kind of process, internalize what the person is saying before you just kind of spit it out, right? Just kind of reflect. 3-item gratitude journal every night. Write 3 things that went well to fight hopelessness. Role play tough moments. Practice asking for extensions or apologizing with a parent slash therapist. A point reward system. Earn points for completed tasks. Trade for screen time or snacks. Weekly wins plus adjust review. All right. Do a 10-minute Sunday check in on what worked and what you need to tweak for the next week. Right. A point reward system is a great idea for teens, parents. If you have teens that are struggling, give them a point for each task that's completed. Hey, you get 10 points. We get to get something to eat. You could go see a movie. You get to get what is a list of appropriate rewards that you like. All right. How much is an appropriate or fair amount of points for each reward? Right. It's a great way to motivate teens. So, dopamine, right? The role of dopamine with ADHD is very important. Dopamine is the fuel that tends to be missing, right, from a lot of ADHD brains, especially in teens, right? Research from fMRI scans show that the reward pathways light up way weaker than average when tackling stuff like homework or chores. That's why school feels like dragging nails on a chalkboard. Your brain craves instant hits because the dopamine hit from boring task is lower and it barely registers. All right. When it's imbalanced, like an ADHD, everyday pleasures like finishing a book or hanging with friends without chaos do not spark joy, leaving you chasing quick thrills like scrolling or snacks that dump dopamine fast, but the crash is hard. All right. Studies from places like NIH, National Institute of Health, tie it to lower baseline levels in the prefrontal cortex, making delayed rewards, right? College applications or exercise feel pointless. So your mind zeroes in on short burst dopamine bombs. All right. So delayed rewards. All right. This is a good discussion to have parents with your children around things, even between parent, right? What are some activities that more than likely have delayed rewards, right? Homework, studying, exercise, eating healthy, different things like that. Okay. Tell yourself, what are our expectations around our teens' performance in these areas? We already know the reward is delayed. If they have ADHD, more than likely they're not going to be motivated. All right. Setting your expectation is a good way to kind of reduce irritability, frustration, right, around the team not meeting those expectations that may not be realistic considering the symptoms. Okay. So, says here studies from places like NIH tied to lower baseline levels in the prefrontal cortex, making delayed rewards feel pointless. So your mind zeroes in on short burst dopamine bombs. The fix, hack it back with the Pomodoro technique, giving yourself many rewards, body doubling ads, social buzz, turning low reward grind into something your brain actually wants. All right. So it's so important with ADHD to give yourself some grace. All right. That negative thinking that you have, challenge it, right? Counter it with something that's more positive, that's more hopeful. That inner critic, you want to pair it with the inner coach. If you can't be your own coach, think of someone in your life who's been positive, who's been uplifting, who helps you to see yourself in a greater light, right? Whether it's your football coach, your basketball coach, your soccer coach, your golf coach, your swim coach, whoever, your track coach, your parents, uncles, aunties, cousins, your pastor. Think of who could play that voice, right? And just imagine them bringing you up, building you up. Okay. When you have those moments, ADHD manifests in a lot of ways when it spills over into adulthood, where you just see a lot of couples not have motivation even to complete therapy, homework. All right. And it's hard, even with the inattentive brain, to even focus on a skill, right? Inattention, in a way, can be very challenging because it's hard to embrace the rewards and the things that are working in your relationships as you get older, things that are working in your friendships. It's hard to stay with the wins with inattention because the brain just kind of monkey swings to one thought to another. So it's like, yeah, okay, we got to win, whatever. This person let me down, right? You're kind of going right to the problem, right? It's hard to sit with ADHD with success sometimes because we have the negativity bias in the brain. When things don't work, things are failing, there's gaps, there's stuff missing. We just kind of gravitate to that stuff more, right? So sometimes when you're dealing with someone who you may feel like, man, why they're not grateful, right? Why are they not appreciating what I'm doing? Why is it seem like I'm doing it, and it's not sticking? You might be dealing with an ADHD brain or someone who has ADHD like symptoms where it's really hard for them to sit, with success out of the fear of something going wrong, or just for the fact of the inattention likes to swing around from thought to thought. All right. So, one thing that you can do if you do have ADHD as a teen is sort of sit with your success, right? If you have a win throughout the day, that worked out for you, or a victory in the day, sit with that victory for like 10 seconds, right? Just kind of marinate in it. Like, man, I nailed that assignment. I thought I was going to bomb it, man. I was able to get permission to get accommodations for this exam. This company is very strict. I didn't think I was going to get these accommodations. Sit with that for 10 seconds. If you have an ADHD brain, train yourself to sit with your successes. Don't let the success just come and go. All right. Sit with it. Even schedule some time throughout your calendar where you have a sitting with success time, right? Maybe it's from 7 to 7:30, 7 to 10, 7:10, right? You get off of work and you get out of school. Sit with your successes. All right. So this is on ADHD and teens. Also, I think this could be helpful for adults as well. Hope this information was helpful. You guys have a blessed day.